Hello, dear viewers. This is the terrifying reality of Hantavirus, a silent killer hiding in plain sight.
Imagine cleaning out an old shed or cabin after a long winter. You stir up dust, and days later, you develop a fever that quickly turns life-threatening. This isn't fiction. It's the reality of Hantavirus, a rare but often deadly virus carried by rodents. In this video, we'll explore what Hantavirus is, how it spreads, its symptoms, history, prevention, and the latest developments. Stay with us. This knowledge could save lives. Let's dive in. Hantaviruses are a family of viruses in the Hantavirus genus. They primarily infect rodents without making them sick, but when transmitted to humans, they can cause serious disease. 8C0D6127B1F9. There are two main clinical syndromes: Hantavirus pulmonary syndrome, HPS, or Hantavirus cardiopulmonary syndrome. Common in the Americas, it primarily attacks the lungs, leading to severe respiratory distress. Hemorrhagic fever with renal syndrome, HFRS. More common in Europe and Asia, it affects the kidneys and can cause bleeding and organ failure. These viruses are named after the Hantan River in South Korea, where the first strain was identified during the Korean War in the 1950s. Today, dozens of strains exist worldwide, each linked to specific rodent hosts. AB43A8. In the United States, the most common is sin nombre virus, carried by deer mice. Hantavirus is a zoonotic disease. It jumps from animals to humans. The primary transmission route is inhalation of aerosolized virus particles from rodent urine, droppings, or saliva. When these dry out and get disturbed, during cleaning, sweeping, or even hiking in infested areas, the virus becomes airborne. Other less common ways include direct contact with rodents or their nests, rodent bites or scratches, rare, touching contaminated surfaces and then your face. Important note: most hantaviruses do not spread person to person. The exception is the Andes virus in South America, which has documented limited human-to-human transmission through close contact or bodily fluids. Risk is highest in rural or semi-rural areas, especially in spring and summer when rodents enter homes. Activities like camping, farming, or cleaning long-closed buildings increase exposure. Symptoms and progression. Symptoms usually appear 1 to 8 weeks after exposure, often 2 to 4 weeks. Early signs mimic the flu, making early diagnosis tricky. 8CD96F prodromal phase, first 3 to 5 days. Fatigue, fever, and chills. Muscle aches, especially large muscles, thighs, hips, back. Headache, dizziness, nausea, vomiting, diarrhea, abdominal pain. It can rapidly progress to a cardiopulmonary phase with shortness of breath, coughing, fluid-filled lungs, pulmonary edema. Low blood pressure and shock. HPS has a case fatality rate of around 30 to 40% in the US, though supportive care improves outcomes. For HFRS, Europe/Asia, progression involves kidney issues, low blood pressure, and potential hemorrhage. Fatality varies from under 1% to 10 to 15% depending on the strain. If you have flu-like symptoms after rodent exposure, seek medical help immediately. Mention the exposure to your doctor. Hantavirus gained attention in the US with the 1993 Four Corners outbreak in the Southwest, linked to deer mice during a period of high rodent populations. Since then, the CDC has recorded about 890 confirmed cases in the US through 2023, with roughly 1/3 fatal. Most cases occur in western states like New Mexico, Colorado, and Arizona. Fewer than 30 cases are typically reported annually. Globally, thousands of HFRS cases occur yearly in Asia and Europe. In 2026, an Andes virus outbreak on a cruise ship drew international attention, highlighting the virus's potential in confined spaces with a rare person-to-person transmission. DABD6 hantaviruses remind us that human encroachment on nature and climate factors influencing rodent populations can spark outbreaks. Diagnosis, treatment, and prevention. Diagnosis involves blood tests for antibodies or viral RNA, often coordinated with public health labs like the CDC. Early suspicion based on exposure history is key. Treatment. There is no specific antiviral cure or vaccine widely available for hantavirus. Care is supportive. Oxygen, mechanical ventilation if needed, fluids, and monitoring in an ICU. Ribavirin has been used experimentally for HFRS in some regions but isn't standard for HPS. Prevention is your best defense. Seal entry points in homes, garages, and cabins. Use traps or professional pest control for rodents. When cleaning, ventilate the area. Wear gloves and an N95 mask. Wet down droppings with disinfectant, bleach solution, before cleaning. Never sweep or vacuum dry material. Store food in rodent-proof containers. Avoid camping in areas with known infestations. For researchers or high-risk workers, follow biosafety protocols. Simple actions like these drastically reduce risk.
Hantavirus is rare but formidable. By respecting wildlife boundaries and practicing good rodent control, we can minimize
Thanks for
threats.
watching. If you found this video helpful, like, share, and subscribe to my channel for more reliable medical information. Take care and stay healthy.